Christine Diaz has been in practice since 2004 as a registered nurse and works in an oncology outpatient unit in Sault Ste. Marie. She started out studying to be a divorce lawyer, but found herself drawn to the medical field. There is a saying, if you do what you love, you will never work a day in your life, which sums up what she feels every day when she goes to work. Christine, welcome to Elevating Women's Wellness. Thank you for being here today.
Thank you for having me. I am so honored and I am happy that I'm able to talk about my profession as well as this profession that is very special in our community.
Yes, absolutely. It's my pleasure. So, start out by telling us about yourself and how you became interested in nursing and specifically oncology.
Absolutely. I'll give you the Coles Notes version of it because it is a bit of a long story. I actually left the Sioux in 1993 after I got married. My husband is a Canadian Forces veteran. So when he left, I went with him. And in doing that, I had left behind my family and my comfort zone here in the community. I had to have gone through school, as you said. I studied law, wanted to be a divorce lawyer. I actually had time to sit in our courtrooms with one of our honorable judges, Judge Greco. And in doing that, I realized that's just not what I want to do. Sitting in family court, sitting in young offenders, it's not something I wanted to pursue. I still like the legal aspect of it. So I decided to do my administrative law. So I did that before I left after I got married. Unfortunately, when you are a military spouse, they have any community you go into, it's difficult for you to find a job because you are posted frequently. So in order for your employer to have to, put in the effort and the time and the expenses to train someone, unfortunately, we get posted frequently. In saying that, I pretty much followed him around his career until we were able to come back to the Sioux. And when we did, I was accepted into our college program here, into the nursing program. Prior to that, I had done some biology, my chemistry, everything I needed to do to update myself. While I did that, I ran a daycare, I worked, everything on top of everything else. So there's that multitasking that us women do that we're so known for. So once I finished school, I got my diploma in nursing because at the time it was just a diploma. They were in the process of transitioning to the degree. I did that. I graduated. I actually worked in the States for a little while. We are a border town, so I did. I had the opportunity to work at War Memorial, which I really enjoyed because it's a different setting working in an American hospital as opposed to a Canadian hospital. After I did that, while I was working still at the hospital, I decided I wanted to go back and do my degree. So Laurentian offered an online program. So I took advantage of it and I did my Bachelor of Science in Nursing online while I was working. Then one of my consolidations was in palliative and oncology. I enjoyed palliative. Oncology was a challenge. It's a steep hill to learn all those different medications and the patient acuity. It's an interesting subject, but it's a constantly changing, diverse kind of a career. So my grandmother was a patient on the oncology unit. So she was under the care of one of our renowned doctors here. And when I went to go pick her up, she was coming home. I went to go pick her up. I had ran into my manager who was there when I was consolidating. And she says, Christine, I'm looking for someone who can come and work in this department. I'm like, oh, I don't know. I wanted to do trauma. I wanted to do emerge. I wanted to do the fast paced stuff. I'm like, I don't know. She's like, no, trust me, you can do this. So I sat on it. And my grandmother overhearing this said, oh no, you need to do this. I'm like, Grams, I can't. I don't know if this is for me. Long story short, within a week, I had been given an opportunity to work in the oncology unit. I got my training, and the colleagues that I work with today, I am fortunate that those are the ones that mentored me, that got me through those humps, those challenges of working in this department. And from that day on, there is no other place I can think of that I want to work. It's a very special department. You have special patients. that you get to work with. And being able to know these people because they're in your community. You've seen them in a grocery store, you've seen them here. It's that bond that we have as health professionals. But in oncology, it's just that much more special. You always hear of someone who has cancer or someone who was diagnosed. And it's a very common disease that we're hearing lately. So for me, it was very special to be a part of that team because I consider us, I mean, any healthcare professionals right about now, we're an elite group. So, but I find that we are so bonded together, myself and my colleague.
I love the story that you shared. It's quite an incredible journey that you've been on. And I wanted to touch on a few points and say, thank you to your husband for his service. And I think that military spouses also deserve an equal thank you. I work with veterans in my practice, so I have some insights into what that unique lifestyle can look like. So, first
Absolutely.
and foremost, thank you. And I think it's, really it's a special calling to be in healthcare for one, but it sounds like you're really devoted to your patients and so are your team members that you work with, and that it's a different calling. And I think it speaks to it as well that you've all been there for so long, right?
Absolutely. Absolutely. We've had a few that have just recently retired, but they come back. They come back part time. They just can't get away. It's that, and like you said, it's that calling, it's that special bond we have with our patients that we don't want to let go.
Yeah, yeah, understood. So tell us a little bit about who the typical patients are that you're treating.
Majority of our patients, they have an array of different diseases and different cancer diagnoses. Most of our patients, we see anywhere from an age group of in their early 20s right up to their 80s and 90s. Everyone who comes through that door has a different story. Everyone who comes through has different environments, has different dynamics. So it's a very interesting group of people that sometimes we come across. We have, young moms, or we have retirees, or we have farmers, all different diverse groups of patients that we see that come through those doors. Each one of them has their own story.
Mhm. Yeah, I think that's amazing too, the type of that you have such diverse people that you're able to care for and to treat, and that you get to know them as individuals. It sounds like from what you're sharing that they each have their own story.
Absolutely. And each one of them come with a family member who may have been touched by cancer somewhere else down the road, or may have had it themselves. There's been numerous times we have had spouses who we treat together,
Mhm.
and it's very interesting.
Yeah, no doubt. What is important for women navigating a cancer journey to know from your specific clinical insights and your experience and knowledge?
When we talk about the journey and speaking with our women, they describe their experience as just that, a journey.
Mhm.
Most of the time, it's not a journey that they would have picked to go on, or something that they would have ever thought that would happen. But this journey sometimes can present an opportunity for these women to change things, to look at a different aspect, to prioritize different things. It's important that they recognize that this cancer doesn't define them in their journey, and that they are more than that cancer. That's very important. We do a lot of communication with our patients. Um, we develop that bond. We see them from day one right through till their treatment is done.
Mhm.
They know about us. We know about them. They know about our family. Most of them know about our kids, what our kids are going to do, what their plans are in life. So we have that very close bond, and we take that journey with our patients. We don't
Mhm.
let them do it by themselves. We maintain an open communication with them. We let them talk about anything. There's no question or no topic that's off the charts. We tell them that you can ask us anything. We've heard it. We've seen it. There's no question that we cannot answer for our patients.
Yeah, that's incredible. I think to have that open communication, it's something that is so needed, and to be supportive in that way. And I know for a lot of women, one of the most challenging things could be hair loss. So in the case of hair
Yes.
loss, how can women cope with it emotionally? What do you know? What have you learned about that?
Well, when it comes to hair loss, that's a very sensitive subject with our patients.
Mhm.
When it comes to hair, it's like it defines us as a woman. Um, and some of our patients, unfortunately, we've had some who will decline treatment because of the impact of hair loss and the emotions that they're going to feel when they go through treatment. What we do is, again, with our communication and our education with our patients, is we let them know that this is temporary. Hair loss is temporary for them during their treatment. And we explain the rationale as to why. While they're going through treatment, the hair does not have time to grow back. So some of them will take comfort in knowing that it is temporary. We always tell them, and we do have some that embrace the fact that yes, we know this is going to happen. They've known about treatment all their life. They've heard it from stories. They've heard from other patients. We have some that embrace it. We have a program in the Sioux. We have close connection with a business here that offers wigs for our patients. The personnel that work there are fantastic with our patients. They're so nice and comforting, and they're so patient, and they help them with wig fittings, or they help them with the color, any of the styles. Sioux College also had a program with their hairstylists, that they're ones in training, that our patients can go to them with their wig, and they can have it freshened up, colored, treated, anything for free. So that gives these women this sense of their dignity back and their selfness, knowing that they, if they have a wig. But we also have those that just, you know what, I embrace the fact that I don't have hair. I'm okay with it. And we have a lot of them that come in with just a bald cap, or just a little a headpiece or anything like that, and they're fine with it. I've even had a few patients where they buy different colors of wigs. So it's like, I get to be a blonde today, or I get to be a brunette or a redhead. So some of our patients have fun with it. So, but in going through all this education with our patients, it's very important that we maintain that it is a temporary hair loss with
Mhm.
our patients. It does come back. And we always tell our patients, we don't guarantee the color, style, curl, straightness, anything, that it comes back. And we usually get a chuckle out of it for that.
Yeah, yeah. I think it's interesting to hear the range of different responses that women might have to that, and that there is an opportunity to consider choosing the response that you might want to have if that is something that you're facing, and to also know that there's some really wonderful resources and people in the community to support you through that journey should you be facing hair loss.
Absolutely. We connect our patients with as many resources as we can, just so that they can help them get through this journey. Like I said, for most of the women, your hair defines who you are.
Mhm.
Okay, so it can be a challenge, and it is. It's very emotional when they start to lose their hair. And we tell them, your first cycle of treatment, you're going to notice that not much is happening. It's usually by this next cycle of the treatment, and it's to specific treatments. Not every woman loses their hair.
Mhm.
So, and then when you see our male population, it's a norm for them
Mhm.
if they lose their hair.
Yeah, thank you for sharing your experience about that. I'm wondering, what are the key elements for a successful recovery from cancer in your observations?
Well, if the biggest thing, and I've discussed these with my colleagues as well. The biggest thing we have seen, and in my 17 years of doing this, and I've had colleagues who have worked with there for 25, 30 years, having a positive attitude is so beneficial, not only for your mental health, but it helps in that recovery time. It helps, to get through some of those symptoms you have to manage. A positive outlook is huge when it comes to recovering from your treatment. Also, accept that your recovery time is going to take time. No one expects you to jump right back into the role that you had prior to being diagnosed. You need time to heal. Your family will understand that. Communication with your family is a big part of healing and recovery and getting through this treatment that you've been on, this journey. It could be 6 months, could be a year that you've been doing this. So understanding that you will heal. It just needs to take time, and you do it at your own pace. You do it on your own timeline.
Mhm.
And don't feel like you're being selfish if it takes a little bit longer and you need extra help or you need extra time. This is all normal when you're going through a cancer treatment.
Mhm. Yeah, I think those are really important pieces to keep in mind. The expectations, the communication, like those are all really important pieces. And
Absolutely.
on the topic of healing and self care, how might women who are feeling higher levels of stress, navigating the cancer journey, adapt their self care practices in times like this?
As women, we want to do everything. It's innately
Mhm.
inbred into us. We are the nurturers of our family. We want to do everything. We have that I don't want to say control, but we have those hats that we wear, multiple hats. We're a wife, we're a mom, maybe a school teacher, a health professional, a doctor, anything that we're doing, we have that where we need to have that job. We need to understand and accept that it's impossible to do everything. We
Mhm.
need to relinquish some of that. And in high stress, it's time that you take care of yourself. Don't feel like you're being selfish if you're taking care of yourself. You have to take time for meditation sometimes, relaxation. Have that soothing bath, like just shut everything out around you.
Mhm.
Connect with your friends, go to a movie with your friends, anything like that. Anything to decrease that amount of stress that you're going through, not only as a role as a parent or a wife, anything like that, but you're also a patient. You have to remember that there's that part of that role as well. And we can't do everything. And we have to, as women, we have to understand that it's okay to ask for help. It's okay to delegate jobs. It's okay to ask family and friends. 9 times out of 10, our family and friends want to do stuff for us.
Yeah.
And they want to do it. They're not doing it because they see us as being sick. They want to do it because they want to help. They understand that we can't do everything.
Mhm.
It's we have to learn to understand and accept that it's okay that we relinquish some of our hats and our multitasking. I look at it as if we don't take care of ourselves, how are we expected to take care of someone else? So,
Absolutely. That's a really important question. I think you've highlighted so many great things in your response, including that self care is not selfish. There's an expression
no,
to describe that because I think we do need to prioritize our self care as women, and particularly when you're healing. And like you said, you have the role of a patient at that time. And that's an important role to be working through and to recognize that that's the case so that you can do the healing work that's needed.
absolutely, absolutely. It's important that you take the time for yourself as well because you're just as important as everyone else around you.
Yes, so true. Now, considering that you've worked in this field for some time and you've been mentored by some incredible coworkers, I'm really curious to hear what life lessons has working in oncology taught you?
That's interesting. Well, you know what? It's when I look at it, when I look at our patients that come through and my colleagues who have been there for so long, I think one of the biggest things is don't take anything for granted. We're in a
Mm,
culture where we work, work, work. We're working towards our retirement. We have a bucket list of things we want to do. We want to travel. We want to see family. We want to see friends. We're working towards our retirement to get there. And honestly, being in this field, it's a new perspective on doing things now. There's no guarantee for tomorrow. Don't wait till retirement to plan all these things, to plan your trips, your travels. It's important to do that stuff now while you're working. Our patient loads, when we see our patients come through, we hear their stories, we talk to them. They're 1 to 2 years out of retirement. Guess
mm,
what? they had a chance to maybe travel once or twice, not everything they wanted to do on their bucket list, but now they're spending their retirement with us. We're honored, we're flattered that they are spending their retirement with us, but wasn't in their plans. So if I can think of anything when you're in a profession like this, I always look at that. There is a saying that I have, and I've told my colleagues this as well as my patients. Enjoy what you have. Enjoy what you've worked so hard to do. Enjoy it in the now, in this frame, because we don't know what's happening tomorrow. Life is very, very interesting. Um, the saying is, eat the cake, buy the shoes, take the trip.
Yeah.
Don't wait till retirement. Do it now while you can, while you may have your health. Retirement is something, it's a cultural thing. But what I really express to our patients, and I mean, we've told this to our colleagues, and we debrief. My colleagues and I do a lot of debriefing at the end of our shift, just to see how things go and how our patients are and the stories we hear from our patients. And a lot of our patients tell us the same thing. You know, thank you for doing what you do. And if you have the opportunities to take a trip, do a travel, spend time with friends, spend time with family, do it now. Don't wait until you hit that magic age where you've retired. Because sometimes when you get to that point, your health may not be the greatest and you might not be able to do those things.
Yeah, what you're sharing is really hitting home, and I'm so glad that you're sharing this wisdom. And, if I think about too my own experience of people passing and just, in life and hearing from others that so often when someone has passed that enjoyed life, it's something that's represented as such an admirable thing. Like, they lived life to the fullest, they really
Absolutely.
enjoyed everything. And in contrast, if someone was sort of preparing, squirreling things away, getting ready, making all the plans, and they didn't have the opportunity to really fulfill those plans that they had, everyone sees it as such a travesty that they were never able to do that. They were never able to really experience that, the joy that comes along with those plans that they had for themselves.
Absolutely. Absolutely. It's life is so precious.
Mhm.
And when we look at our patient cases, I mean, a lot of our patients are in older stages of their life, but they always tell us, oh, I used to do that. I used to go to Florida, or I used to go here, or I used to go there. And now I've worked so hard, and it's that whole, it resonates with you as, in the profession I'm in, I mean, I would imagine in our physicians as well, but it's a wake-up call is what it really is. It's a wake-up call to enjoy every day as it is your last.
Yeah.
So, and we do, we get together, my colleagues and I, we get together, we do lunch and learns, we do webinars, and it's our time to kind of bond, but it's also our time to realize, okay, it's kind of a reset. So
Yeah, yeah, absolutely. I can imagine in your profession and your experience that you're being reminded of that all the time.
all the time.
Yeah, for sure. So, Christine, I have one last question for you. Resilience is a topic that's so important to women's wellness, and it's a topic that I absolutely love talking about and hearing from others on as well. What does becoming more resilient mean to you, and how does it apply to the women that you treat?
That's an interesting question. And when I was looking at that, I'm like, if we look at the textbook definition of resilience, it's the adaptation uh, of what's going on in your life, how you face adversity, the challenges that you're facing. With myself, if I think about those 25 years that I followed my spouse in all of his little adventures, um, he did a lot of time overseas. So I was by myself a lot. So I had to adapt to being, I call it single but married. That was like a term that we used. And then my kids that came along. So just because I had kids doesn't mean his career stops. He was a soldier 24 hours a day, 7 days a week. So I had to learn to adapt to him being gone, me being by myself. I'm in a different city. I'm not even at home with my family. But I think in doing that, I have become a stronger person myself. My personality, how I deal with things, how I adapt to my environment, the challenges I face, I take them head on, and it doesn't fizz me, it doesn't phase. Um, and I instilled that in my kids. I have a daughter who's 22 and my son who's 24. I have instilled that resilience in them when I see how they are today and the careers that they're pursuing. And for myself, I think I've come a long way. And it defines who I am as a person and my personality. If you were to ask any of my colleagues, even my patients, because again, we are so close in bond with our patients, they see me as this tough person. I'm really not. It's a facade. I'm a very gentle person. But when they see me, they're like, oh, and they know my story. They know my story about my husband, my adventures, as I call them, through my 25 years of being a spouse with the military. Um, so it's in having that and in able to experience that myself, I can portray this with my patients. Yes, you're going to have to adapt to a new norm now because this is not something that you expected. But you can adapt. We can help you adapt. We can get you some coping skills. We can offer support groups. Tell us what you need. Let us get what you need. So when we talk to our patients about resilience, a lot of them are very very strong minded. Our women that we treat, um, I look up to them because they've got stories too, but they still keep going in their role. They know that they've got this diagnosis, but you know what? I still need to be a wife. I still need to be a mom. I still need to do this. And we do have some that they come in for their treatment, they take their 1 or 2 days rest, and they're right back at work doing what they love. So they've adapted to what's going on in their life, and they've made sure that they can still continue to be productive for them. And that gives them some sense of relief and some sense of productivity and that they're doing something for themselves.
Yes. Yes, that's amazing. I love how you describe that from your own experience and how it applies to your patients, and that you really look up to them in terms of, how they handle things. It's amazing. I want to thank you, Christine, so much for sharing your knowledge and wisdom experience here today. Undoubtedly, this is going to support so many people, what you shared. So thank you again.
Well, thank you so much for having me. This was fantastic. I love it. I love being able to speak with regards to the patient case that we have, and things that are in our community that maybe some of our patients don't realize are there. And it gives me an opportunity, to kind of put a face to names or to what's going on in our clinic and in our program. And like I said, we love what we do. My colleagues, myself, our physicians that we work with, we love what we do because if we didn't, we wouldn't be there.
Yeah,
So
truly.
this is it's very rewarding for me. I have 8 years before I retire, and this is where I'm going to retire from, is from my oncology department.
Yeah, I love it. Well, your passion really shines through, and thank you again for the work that you're doing.
Thank you so much. I appreciate this.